My specialism is with preschool children, and I work primarily with children in children's centres across Bradford district. And I also am responsible for the assessment clinics for the children who are under 4 years old, and that's their very first appointment with the Speech and Language Service. There are 3 areas of work that we are involved in, 3 levels of activity. One is preventative work, the second is early intervention, and the third is ongoing work with children who have ongoing speech and language needs. In terms of the preventative work that we do, we work with parents and with professionals to give them the skills that they would need to inform parents of the right things to be doing to help the children's language and communication development. So that if all people who are relating to the children have the right skills, then hopefully we are going to prevent some children having speech and language delay and needing our services. And the second area, the early intervention, is where we're working with children who have we already know that those children have a speech and language difficulty, and we will be working with the parents and any nursery staff who may be involved with the children, again to give them the right strategies to help to support those children's communication. Hopefully that will be a short-term piece of work that we're doing, and again the children's problems will resolve and they won't become a long-term part of our caseload. And the third area, there are and there always will be some children who have significant speech, language and communication needs who need our services on a very intensive basis over a long period of time. And they will always be part of our caseload and will always have to come and see us. And that is obviously a significant part of the work that we do. But often the communication is linked with emotional and behavioural difficulties. You can imagine if you can't talk very well, it's difficult to express your needs. So a huge part of my role is helping children to be able to communicate so that we hope to prevent difficulties with children's behaviour where we can, or to alleviate those difficulties. We have an open referral system, so anybody can refer a child with the parents' permission. So it could be the parents themselves, it could be the health visitors, GPs, paediatricians, school staff, nursery staff, anybody who has a concern for that child. We have our assessment clinics across a variety of places, mainly children's centres, but we also use some health premises, so some health centres, and we use a relaxed, friendly, child-friendly play setting for the children so that hopefully they are feeling comfortable and will talk and communicate at their best. We have families from a wide range of different countries and cultures, and they speak a huge range of languages. Because we have an open system, everybody is able to come to us. We are happy to work with families from whatever language they speak. An additional part of my role is within the children's centres. There is some provision for children who have additional health needs. So children with genetic conditions, maybe children with autism, anything that's making their communication complex, then they fall within my role, and I will work with them alongside the children's centre staff and the parents to help those children achieve their potential. Those children with complex communication needs will also come to the assessment clinics because they are referred and we are part of working out what the children's needs are. In summary, the work that I do with the very young children is helping them to have the skills that they need to progress through their life, their education and their work life in the future, that they would be able to communicate verbally and also develop the literacy skills as they get older. But we know that children who don't learn to communicate potentially have long-term difficulties within their life, that they don't develop the life skills they need to be able to become active, positive members of the community.